Okay, so this is big. We may now soon have a legit eye drop to help reverse cataracts. No, I'm not talking about castor oil. And no, I'm not talking about NAC eye drops either, as we've myth busted both of those in previous videos. But what's new is that right now, researchers here in the US are actively investigating an experimental eye drop to reverse cataracts, and it's being done in human clinical trials. And what's exciting is this new drop is designed to help break down proteins that cause cataracts to form in the first place, so that they may not just potentially slow down their development, but may even reverse cataracts that have already formed. And this is huge because if it works out, they will effectively made a true cure for cataracts. And cataracts happens to be the number one cause of blindness around the world. Plus, it also means you probably won't need to have cataract surgery, and most people will want to avoid having eye surgery if possible. But before you get too excited, there's actually a catch. In fact, there's a few. First, the current clinical trial just started, and they're testing for not only the efficacy, but also the safety of this new experimental drug called ZOC 2017217. I know that name just rolls off the tongue, doesn't it? But they're testing it on people with age-related cataracts versus placebo, and they're going to run it for 24 weeks. But this drop is derived from a naturally occurring steroid molecule called lanosterol, which is known to help break down crystalline proteins from forming inside of the eye, which create the cataract. Now, it's been reported that in previous exploratory studies, up to about 86% of human participants had reported improvements in their vision. But, of course, they need to confirm these findings and prove that it's safe. Now, the first catch here is that this study isn't expected to be complete until about May of 2027. And even if it goes well, they're probably going to still need additional studies afterward, especially considering this study only has about 40 participants in it. So even if this drop works great, I still think it's going to take at least 3 to 5 years before anybody actually gets access to it. Meaning if your doctors think you're already a good candidate for cataract surgery, then probably not best to wait on this one. But if you do have questions about cataract surgery at all, be sure that you're subscribed to the channel and turn on the notification bell, because soon we will be releasing an episode of the Dr. Eye Health podcast. And there we're going to be interviewing one of the leading experts in refractive cataract surgery, where we address all of the common questions about cataract surgery. I think it's going to be an amazing episode, so definitely stay tuned. Okay, but now let's talk about some other big issues, which frankly, I just haven't heard anyone talk about yet, but I can definitely see some problems further down the road. The first big issue that comes to mind is, of course, money, right? Let's say this thing works out. Let's say it does in fact reverse cataracts. Do you honestly think that a cure for the number one preventable cause of blindness in the world would be cheap? No, it's probably going to come at a premium price, which means that if you're somebody who has the money and can afford it, awesome, you're going to probably get it right away. But for everybody else, people who probably actually need it, like people who don't have access to a surgeon, people who can't afford it and need to rely on maybe health insurance to make ends meet, good luck. Plus, keep in mind that cataracts progress over your lifetime. So I imagine if these do work, people are going to have to start taking them consistently every day or frequently over the course of many years. And we still have no idea what kind of side effects would potentially come out from somebody taking this type of medication for decades. And the second big thing that comes to my mind, and is honestly like a $10 billion question, and this is because cataract surgery is one of the most frequently performed surgeries in the world. It is a massive industry. You not only have the surgeons doing the procedure, you have the clinics or hospitals where they do the procedure. You also have the companies who make the instruments to do cataract surgery and the implants that go inside the eye afterward. So if you can replace all of that with a simple drop, then you're not just changing the cataract treatment, you are completely disrupting the entire eye care industry. And here's the part that concerns me, and I think should worry you too, is because this is all coming at a time where fewer and fewer doctors are choosing to go into ophthalmology or specialize in eye surgery. That means if cataract surgery becomes kind of a rare thing or a thing of the past, then that means less and less doctors who are trained and experienced being available in your area. There may not be an ophthalmologist within hundreds to thousands of miles from where you live. And so getting access to good, experienced surgeons becomes a rarity. And the ones we have are probably going to be so busy, it'll probably take a long time before you'd see them. That's, of course, not a reason to root against this type of technology, but it is a reality that we have to face when it comes to how it can affect the industry and access to care in your area. And then third, or finally, a new treatment this disruptive definitely attracts a certain amount of attention, right? And I'm going to be a little bit cautious of how I say this because I don't want to come off and sound like a conspiracy theorist. But when something challenges an industry and may potentially hurt somebody's bottom line, there is something called a killer acquisition. Basically, where a company may purchase a project and shelf it just to help prevent competition. I'm in no way saying that this is what might be going on here or could happen. I have zero evidence of that. But what I am saying is that the incentive exists, right? Something threatens that $10 billion industry, people are going to notice that. So I'm definitely going to be watching this one, and I want you to watch it with me because if this drop truly ends up being real and reversing cataracts, then we need to keep it real and not just let it kind of die off in a boardroom somewhere. From here, to stay on top of what's happening in the eye care world, including all news, new eye drops, new medications, everything, then consider subscribing to our free weekly newsletter. You can sign up for it at dreyehealth.com or just click or tap the buttons at the top of the comments. I'll pin it there for you. Otherwise, if you want to learn more about cataract surgery or ways to prevent cataracts from forming, then check out my other videos coming up over here to the side. Otherwise, thanks so much for being here. Keep an eye on it. See you in those next videos.